Claudia Gomez had just moved to Canada from Colombia when she had a traumatic experience with a gynecologist. She said she went in for a pap test and was instead given a biopsy with no warning.
I was by myself. I didn't have any path to protect myself. I started bleeding, and she said maybe I could be having pain for some days.
Gomez was a patient of Dr. Esther Park and one of dozens of women who contacted CBC Toronto after we reported the doctor was under investigation for improper cleaning practices. Toronto Public Health says around 2,500 patients may have been exposed to hepatitis B, hepatitis C, and HIV at Park's clinic. Like Gomez, many of the patients recently immigrated to Canada.
I didn't know the system, and I didn't know from my country, it's difficult to access to a specialist. So we have to, look for someone, go through a long process. And I say, okay, if I'm here, so if I ask for a change or whatever, it's gonna take forever. And I was in a difficulty, with my health. So, and I didn't know how to do it. And my English now is not great, but at that time, oh my goodness, it was very bad. And then I felt like hopeless.
Gomez said she ended up going to a nearby nonprofit that provides immigration and settlement support for help. At the time, she didn't know about the College of Physicians and Surgeons as an avenue to file a complaint.
I mean, at the best of times, people are very reticent to complain about their doctors. Very reticent. They're afraid to do it. There's a big power imbalance that's compounded as people are new Canadians. I would say the vast majority of people have no idea where to go, what to do. And if English is a second language, then the language barriers, can make access even worse.
The College of Physicians and Surgeons of Ontario is also investigating Dr. Park. Her license is listed as restricted on the college's website. In a statement, the CPSO says it aims to provide the public with access to services and support in the language of their choice. Patients calling the college can connect with an interpreter in one of 240 languages, ensuring any questions or concerns are accurately presented.
I would always encourage people to make a complaint to the college. The college investigates, so they do an investigation, and that's important because if there really is a problem, that's really the only accountability.
It's not just about giving individuals the power to complain, but also creating proactive measures to make sure that whether it's bosses or service providers or healthcare workers or landlords, that they are the ones receiving the education. They are the ones that are being informed about the potential consequences coming down from their disciplines in the departments and the provincial government in particular.
CBC News has made multiple attempts to contact the clinic, but we haven't received any responses. The office's answering machine states that Dr. Park is retiring and that the clinic will be closing in April. Meanwhile, Toronto Public Health says there are no updates to the investigation and no confirmed infections related to the practice. It says it will continue to receive lab results and follow up as necessary. Gomez now works in healthcare as an occupational therapist. Looking back, she wishes she spoke up.
At one point, I feel like giving up, and I did it. I just rather want to stay with the illness, and that's it, and to see what's happened, because I didn't want to go back and as an OT here.
Gomez hopes that sharing her story will encourage more patients, especially women new to Canada, to file a complaint or say something if they don't feel their health is in the right hands. Talia Ricci, CBC News, Toronto.